While the Affordable Care Act remains controversial in Oklahoma political circles, a different health topic came under the spotlight at the most recent Republican presidential debate. The event rekindled some parents' concerns about the safety of childhood vaccines and disturbed members of the medical community who fear skepticism about vaccines could lead to a return of life-threatening diseases.
The exchange between Republican presidential hopefuls Dr. Ben Carson and Donald Trump came toward the end of last week's debate, as Carson was asked if Trump should stop saying that vaccines are linked to autism. Carson, a retired neurosurgeon, maintained that vaccines were safe, but stopped short of endorsing the schedule of vaccines recommended by the American Academy of Pediatrics.
We have extremely well-documented proof that there's no autism associated with vaccinations. But it is true that we are probably giving way too many in too short a period of time.
Oklahoma State Senator Irvin Yen, who was also a cardiac anesthesiologist, was disappointed by the response.
I think Dr. Carson does not believe what he said. I think he wasn't ready for that question, and he was trying to be the kinder, gentler candidate and not tackle Donald Trump head on.
Oklahoma law requires children be vaccinated before attending any public, private, or parochial school, but does allow exemptions for medical, religious, or personal reasons. Yen has proposed legislation that would remove all but the medical exemption, citing a rising number of Oklahoma parents who choose not to vaccinate their children. Yen fears that trend could lead to a return of some diseases thought to be nearly eradicated, pointing to a measles outbreak earlier this year involving more than 100 people that began at Disneyland in California. Yen says Oklahoma's vaccination rate has been falling for several years.
The last year that we have good data for is the 12-13 school year. And in that year, the vaccination rate in Oklahoma was only 90.5. That's 90.5%. And most people agree that for herd immunity, you need to have closer to 95%.
I haven't seen the number 90.5%. That's a new number that I haven't seen. I've seen more like numbers of 96 and 97%. And a 1.5% exemption rate coming into kindergarten.
State Senator Rob Standridge is chair of the Senate Health and Human Services Committee and a licensed pharmacist. Standridge last week issued a statement announcing he would not allow the bill to be heard in committee. Standridge insists the decision was not motivated by concerns about the safety of vaccines.
I vaccinate my own children. I recommend everybody vaccinate their children. And I think that's a proper role for health professionals and to some extent the government to take.
But Standridge says he is concerned about the temperature of the debate.
I didn't want it to be a huge political battle when it's really a very serious issue about public safety and public health. And I saw it going that direction.
A group circulating a petition opposing Yen's bill applauded Standridge's decision. Liza Greevey is co-director of Oklahomans for Vaccine Choice.
Parents no longer get a choice if they would like to possibly delay or even not give one particular vaccine. The only exemption that would be left would be a medical exemption, and parents don't get to choose that. That is only given by a doctor.
Oklahoma law mandates children receive 5 doses of diphtheria, tetanus, and pertussis vaccine, or DTaP, by kindergarten, followed by a tetanus booster in later years, 4 doses of polio vaccine, 2 doses of mumps, measles, rubella, 3 hepatitis B shots, 2 doses of hepatitis A vaccine, and 1 of varicella, or chickenpox. Greevey says some parents are concerned that's too much.
We want parents to not look at the vaccine schedule as a one-size-fits-all, but to take their family history and their particular child and look at the schedule that way. That's what the exemptions are for.
It's not clear how stretching out the immunization schedule or skipping certain vaccines would affect children's health. Eliza Chakravarti is a clinical scientist at the Oklahoma Medical Research Foundation.
We don't know whether it will reduce the effectiveness of the vaccines. We also have no data to show that it is less harmful. Again, there is very little harm from vaccines, and so it's unclear how spreading them out would necessarily benefit the population.
While no medical procedure is risk-free, Chakravarti says vaccinations are among the safest.
And when you think about the millions and millions of people who get vaccinated each year, the complication rates are there, but they're exceedingly low, less than 1% of 1%.
Senator Yin argues the benefits of vaccines far outweigh the risk.
I'm not saying there's no risk to vaccination. There is. And if you look at the data, both the CDC and there was a NOVA episode a few weeks ago that says the chance of a serious reaction to a vaccination is 1 in a million.
Yin says he's not done with this bill and is still exploring other avenues to have the measure heard by the full legislature.